A 7-year-old child present with chief complaint of non-healing extraoral draining signs on the symphysis region since 1 year. She gave history of multiple systemic antibiotic along with curettage of the extraoral sinuses. The intraoral examination revealed the presence of deep caries along with the swelling and intraoral sinus tract draining throughout multiple stomata. Stoma was found. What could be the probable diagnosis? Well, the presented case description it is indicative of chronic alveolar abscess. So the chronicity of the symptoms, that is, it is non-healing, extraoral draining, and there is a deep carious lesion. They are consistent with this diagnosis. So remember, the chronic alveolar abscess, it is a long-standing dental infection that can result from untreated dental caries. So that can lead to formation of extraoral draining sinuses, and due to the chronic nature of the symptoms, that fits in the present case. Option B is the periapical granuloma. It is periapical granuloma. Remember, it is a localized mass of chronically inflamed granulation tissue that is formed at the apex of the non-vital tooth. Acute apical abscess, it is characterized by rapid onset of severe pain, swelling, and formation of abscess. The chronic nature of symptom described here in this case, along with the history of 1 year duration, makes a acute apical abscess less likely. Option D is chronic hyperplastic pulpitis. It is also known as pulp polyp. So it is condition where there is inflamed dental pulp tissue that proliferates so that is not the option here. The option would be A. Coming to the next is the sawtooth retapex. It is the sawtooth retapex. It is characteristic of the answer is erosive lichen planus. So the sawtooth retapex, so it refers to the histopathological pattern that is seen in certain mucocutaneous disorder, particularly in the epithelial tissue that is examined under the microscope. So the epithelial proliferation, they will exhibit a jagged or serrated appearance, resembling a saw-like appearance. That is why it is known as sawtooth retaregis. So this characteristic finding is a result of the hyperkeratosis. So there would be a thickening of the outer layer of skin or mucosa, and there is irregular epithelial proliferation. So the sawtooth tooth pattern, it is observed along with other histological features like in case of lichen planus, you will see a band-like lymphocytic infiltrate that would be seen along the basement membrane. So the combination of these features helps the pathologist in diagnosis the lichen planus. Coming to the next question, is what is the function of the pilot balloon in the endotracheal tube? Well, the pilot balloon in the endotracheal tube, it is associated with the cuff inflammation system. And its main function is to monitor and control the pressure of cuff that surrounds the tube. The function of pilot balloon is to check the intratracheal pressure. Now we know endotracheal tube. It is a flexible plastic tube that is inserted into the mouth or nose into the trachea. That is commonly referred as intubation. So it is device that is used in situation during the surgery in emergency for mechanical ventilation in critically ill patient. So what are the components of this endotracheal tube? It has a tube body. That is the main part of the tube that is inserted into the trachea. And it is made up of flexible material like polyvinyl chloride or silicone. Other part is the cuff. The cuff, it is an inflatable balloon-like structure located near the distal end of the tube. So it is typically made up of soft and pliable material. The cuff, it plays a role in preventing air leakage around the tube and in facilitating the positive pressure ventilation. So when inflated, it forms a seal against the tracheal wall. So the cuff, it is connected to pilot balloon via small channel within the tube. The cuff inflation, it is important step after the endotracheal tube, it is correctly positioned in the trachea. So the endotracheal tube, it is inserted into the trachea and it is placed and confirmed in the trachea by various means such as auscultation of breath sounds and chest rise. So the cuff is inflated with air using syringe through the pilot balloon. So the amount of air needed for inflation is specified by the manufacturer or determined based on the guidelines to achieve optimal seal within the trachea. Now the pilot balloon, it serves as a mean to monitor the pressure within the cuff. So monitoring the cuff pressure, it is important to avoid overinflation that can lead to complications like tracheal mucosal damage or ischemia, or there could be tracheal stenosis. Coming to the next question, the heat sensitive material are sterilized by, the answer is ethylene oxide. We know ethylene oxide, it is a gas that is commonly used for sterilization of heat sensitive material. It is suitable for items that cannot withstand the high temperature of steam, autoclaving or dry heat ovens. So ethylene oxide, it is effective in penetrating various materials including the plastics, and the fabrics. Autoclave involves the steam under the pressure and high temperature. It is widely used and effective method for sterilization. It is not suitable for items that are sensitive to heat and moisture. So answer is ethylene oxide. Next question. A dentition of 4-year child with early loss of upper and lower central incisor with incomplete root has seen the 3-1 and 4-1. The reason is hypophosphatasia. Now, hypophosphatasia, we know it is a genetic disorder that is characterized by deficiency of tissue non-specific alkaline phosphatase. So that lead to impairment mineralization of bone and the teeth. So in the context of oral manifestation, hypophosphatasia can cause premature loss of the deciduous teeth, especially the incisors. The teeth may have incomplete root formation, and there can be other dental abnormalities like the large pulp chambers. So your answer would be hypophosphatasia. The rickets, remember, the rickets, it is a disorder that is characterized by deficiency of vitamin D, calcium, that leads to weakness and weakness of the bones. So dental abnormalities associated with the rickets are usually related to enamel defect rather than the premature tooth loss. Histiocytosis, it is a group of disorder involving the overproduction of histiocytes. It can affect the bone, but it is not commonly associated with the early tooth loss. The leukemia, it is a type of cancer affecting the blood cells. Leukemia can affect the bone marrows and cause changes in the oral cavity. So it is the most common reason could be hypophosphatasia. What material it is used for taking impression in cleft lip and palate child? The answer is medium body silicone. Zinc oxide eugenol impression, they are commonly used in dentistry, but they are not typically recommended for initial impressions in the cleft lip and palate cases. Alginate is commonly used, cost effective, however it may not be the material of choice for initial impression in the cleft lip and palate. Identify the image that is seen here. It's example of peripheral ossifying fibroma. So remember, it is a lesion that is benign swelling that is seen in the teenagers, and it results from the cell of the periodontal ligament, and it is classified as a reactive hyperplasia, but sometimes a benign neoplasm. Which muscles of pharynx contribute to buccinator mechanism? It's the superior constrictor. The buccinator mechanism involves there is in the buccinator mechanism there is the fibers of orbicularis oris that joins the fiber of lip, constituting the anterior component of the buccinator mechanism. So these fibers then run laterally around the corner of mouth, joining the other fibers of buccinator muscle. So the buccinator muscle fibers, they mingle with the fibers of superior constrictor muscle. So the coordinated action of these muscles contribute to the overall function of the buccinator mechanism that together act like a rubber band encircling the mandible. The tongue, in contrast, remember it exerts an outward force. So the tongue, it acts opposite to buccinator mechanism, exerting a outward force. The perineural spread, it is seen, it occurs in the adenoid cystic carcinoma. The perineural spread refers to tumor that cells that invade and spread along the nerves. So in the adenoid cystic carcinoma, there is this perineural invasion. It is feature and it contributes. So the tumor ability to invade the nerves can make the complete surgical removal challenging. So So the answer is B. The brain autopsy report for the left paralysis patient, it will indicate the liquefactive necrosis. So remember, it is more common in the brain. So liquefactive necrosis, it occurs more frequently in the brain tissues and it is caused by fatal injury to the neurons. The hypertensive drugs were given to pregnant and non-pregnant group of patients. Which test of significance test would be used here? The answer is a student t-test. The student t-test, it is used to compare the mean of two independent groups to determine if there is statistically significant difference between them. So in the context of given study, when hypertensive drugs were given to pregnant and non-pregnant group, the student t-test is suitable for comparing the mean outcome, that is the blood pressure value between the two groups. So answer would be student t-test. A country is taking precautions for disease which has not occurred. Which of following level of prevention is most relevant? It's the primordial prevention. Primordial prevention, it is our focus is on preventing the emergence or development of the risk factor in the countries where the risk factors they have not yet appeared. So answer is primordial prevention.